world where memories shape our identities, there exists a heart-wrenching reality: Alzheimer's disease. It steals away the very essence of who we are, leaving behind a trail of shattered lives. In our quest to understand Alzheimer's disease, we come across remarkable individuals dedicated to unraveling its mysteries. Meet Dr. Shaz, a brilliant neurologist at the forefront of Alzheimer's disease research.
Let's talk about Alzheimer's disease.
So, Alzheimer's disease is a neurodegenerative disorder marked by a cognitive and behavioral impairment significantly interfering with the social and occupational functioning.
How does it start?
Alright, so Alzheimer's disease is a progressive disease beginning with a mild memory loss and possibly losing the ability to carry on a conversation and respond to the environment. So, this disease targets parts of the brain that control thought, memory, and language.
So what are the impacts?
Alzheimer's disease has a significant impact on both individuals and their families, as the individuals may experience greater memory loss and other cognitive difficulties. Family members of Alzheimer's patients are at greater risk of anxiety, depression, and reduced quality of life, as they need to provide care for a longer duration.
Alright, so can you tell me about the common symptoms of Alzheimer's disease and how it affects the patient and their family members?
So, this devastating condition not only robs individuals of their memories, but also drastically impacts their daily lives. One of the most recognizable signs of Alzheimer's is the loss of short-term memory. So, imagine constantly asking repetitive questions, struggling to remember where you place an important items, or even forgetting important appointments. These memory lapses become a constant presence, a haunting reminder of the disease grips in one's mind. But Alzheimer's doesn't stop there. It affects multiple cognitive functions, leading to impaired reasoning and difficulty handling complex tasks. Imagine being unable to manage your own bank account or make some financial decision. Simple actions that were once routine become overwhelming obstacles, leaving individuals with a sense of helplessness. Language dysfunction is another aspect of Alzheimer's that impacts daily life. For example, struggling to find common words or having errors while speaking or writing. The simple act of communication becomes a frustrating battle. Visual spatial dysfunction is one of the symptoms. For example, being unable to recognize familiar faces or common objects. This can leave individuals feel disoriented and lost. Sleep disturbance can also be observed in these patients. Lack of sleep can affect the overall well-being of these patients. Additionally, we can see a neuropsychiatric symptoms. This can include depression, anxiety, aggression, and personality changes. This not only affect the patients, but also the family and the caregiver as well. So, we must remember the importance of supporting those affected by Alzheimer's, not only in the therapeutic care, but also in providing compassion, understanding, and care. Because in this challenge, every bit of support and empathy we can offer can make a difference in the life of those affected by this disease.
Now that we have gained valuable insights from Dr. Shaz, let's delve deeper into the world of Alzheimer's disease. By understanding its mechanism, we can begin to unravel the cause of this disease. In Alzheimer's disease, there are two main things happening inside the brain that play a big role in causing the symptoms. These are the extracellular beta-amyloid deposits and the intracellular neurofibrillary tangles. Let's start with beta-amyloid deposits. Think of them as tiny clumps that form outside the nerve cells in the brain. These clumps are called neuritic plaques. Now, beta-amyloid is a protein that is naturally present in the brain, but in Alzheimer's disease, it starts to build up and form these plaques, and this can interfere with the normal functioning of the nerve cells. It's like having roadblocks that prevent smooth communication between the cells, and this can cause problems with memory, thinking, and behavior. Let's explore another important aspect of Alzheimer's disease, which is the neurofibrillary tangles. Inside our nerve cells, there's a protein called tau that helps maintain the structure and support of cell transportation and skeletal systems, called the microtubules. In Alzheimer's disease, something goes wrong with tau protein. Tau proteins start to twist and tangle, forming structures known as paired helical filaments. These tangles disrupt the normal function of the nerve cells. It's like having a bunch of tangled wires that prevent the cells from working properly. As these tangles develop, the nerve cells begin to degenerate, and this contributes to the decline of brain function in Alzheimer's disease. In the following segments, we will explore coping strategies for individuals with Alzheimer's disease, including pharmacotherapy, non-pharmacotherapy, and lifestyle changes.
Hi there! Moving on next, I will be sharing on the coping strategies for individuals with Alzheimer's disease, mainly the pharmacotherapy. Although there is no exact medication to fully cure Alzheimer's disease at the moment, symptomatic treatment can always be provided to improve the patient's symptoms. It is important to note that these medications may not be able to halt the progression of the disease itself. The available medications primarily target the three main symptoms, which including cognitive symptoms such as difficulties in expressing, memorizing, and concentrating, psychological symptoms such as depression, sleep disruption, and anxiety, and lastly, the behavioral symptoms, which categorized by patients who normally wandering around and showing less interest in things. Now, let's explore on the medications used to improve the cognitive symptoms. Firstly, we have cholinesterase inhibitors, which work by inhibiting the breakdown of acetylcholine, thereby enhancing the cholinergic transmission. This helps to improve memory and cognitive function, especially in the early stages of Alzheimer's disease. The common medications available, including donepezil, which prescribed for all severity level of Alzheimer's disease, galantamine, and also rivastigmine. Then, we have the NMDA glutamate receptor antagonist, which prevents overstimulation of NMDA glutamate receptors, thereby inhibiting excitotoxic reactions. It helps to improve cognitive function of Alzheimer's patients too. However, there are more severe side effects found on the patient's daily living activities and behavior. The commonly used NMDA glutamate receptor antagonist is memantine. Lastly, there is the monoclonal antibody class, which binds to the amyloid beta peptide and reducing its deposition in the brain. One of its examples is aducanumab with the brand name of Aduhelm. However, this type of medication is lack of safety or effectiveness data on initiating treatment at earlier or later stages of the disease. Now, let's shift our focus to medications targeting behavioral and psychological symptoms. Mood stabilizers like valproic acid are used as adjuncts to antidementia medications, although their effectiveness are lack of sufficient evidence. Antipsychotics such as aripiprazole and risperidone are indicated only for anxiety patients with suicidal thoughts. Finally, for individuals with severe mental problems like depression and anxiety, antidepressants are recommended. Tricyclic antidepressants, selective serotonin reuptake inhibitors, and monoamine oxidase inhibitors are commonly prescribed for individuals with depression among those with Alzheimer's.
Here are some general reminders. All medication listed are not available over the counter, so please consult your healthcare providers on the appropriate treatment plan, and do remember to strictly adhere to your medication routine by taking your medication with the correct dosage at the appropriate timing to ensure the effectiveness of your treatment.
Balkis, pukul berapa dah?
Pukul 4.
Sekarang pukul berapa Balkis?
Pukul 4 kan dia cakap tadi. Farid asked the same question many times a day. What time is it? What are we doing? I get so frustrated because even after I answer the question, he will ask the same things again and again. It's driving me crazy. Being a caregiver is not just about taking care of him physically, but it also emotional states. It can be extremely frustrating at times. We are humans, we are not robots.
Let me introduce you to Tam, a dedicated nurse who offers compassionate care for those affected by Alzheimer's.
Interpersonal therapy plays an important role in Alzheimer's disease management, so isolation is a common tendency among many Alzheimer's patients and it can worsen their condition. So this therapy focuses on their internal personal relationships and social functioning. So caregivers can guide patients in communication and resolve any conflicts they may encounter.
I see. So apart from the interpersonal therapy, Are there any other methods that can help the Alzheimer's patient to cope with their challenges?
Absolutely. For individuals with Alzheimer's, responding immediately to environmental changes can be difficult due to cognitive impairment. So this extent of this difficulty can vary among individuals. So some individuals with Alzheimer's may still be able to adapt reasonably well to environmental changes, while others may experience greater challenges in this regard. So however, there are several life hacks that can make their life easier. So the first tip is to stay organized and practice a consistent routine. So planning schedules and adhering to them can help the patients to familiarize themselves with the environment. So by having a daily routine, the person knows when certain things will happen. So keeping important items in designated places can help minimize forgetfulness. So next, simplify the task by breaking them into small and manageable steps and implementing them slowly. It's important to remember that it's perfectly fine to work at a slower pace as long as the desired outcome is achieved. So take a calm approach and tackle tasks one at a time. So other than that, using memory aids like calendars and note reminders can be incredibly helpful. So simply jot down important information on a sticky note and placing them in visible areas so that it can serve as effective reminders. Finally, I must emphasize the invaluable support of family and caregivers for individuals with Alzheimer's. The understanding and compassion they provide greatly influence the well-being of Alzheimer's patients.
But how can we demonstrate our support?
Caregivers should practice patience and tolerance when patients experience forgetfulness. So responding to their questions with gentleness and reassurance can help alleviate anxiety. So additionally, spending quality time together, offering love, providing attentive care can make a world of difference in their life.
When it comes to Alzheimer's disease, making certain lifestyle changes can greatly benefit patients. Let's explore some key points to consider. Firstly, maintaining hydration and a healthy diet is crucial. Drinking enough fluids help prevent dehydration, which can lead to confusion, urinary tract infections, and constipation. Exercise plays a vital role as well. Safe and enjoyable activities like brisk walking, tai chi, and yoga are recommended for individuals with Alzheimer's disease. Staying socially engaged is also important. Socialization helps combat feelings of loneliness and social isolation. Getting enough sleep is vital for brain performance, mood, and overall health. Prioritizing good sleep habits can have a positive impact on individuals with Alzheimer's disease. Lastly, ensuring a safe environment is crucial. Caregivers should eliminate safety hazards and be prepared for emergencies.
Alzheimer's disease is a neurodegenerative disease in which it is manifested by loss of neurons in the brain. It is the most common type of dementia as it causes symptoms like poor memory, difficulty learning new things, and as the disease progresses, patients are unable to carry out daily activities independently. Generally, there are a few coping strategies available for the Alzheimer's patient that are categorized into pharmacotherapy, non-pharmacotherapy, and some useful life hacks. Although there is no cure for Alzheimer's disease, medications such as cholinesterase inhibitor, Danpazil can elevate patient symptoms. Therefore, patients should always adhere to their medication routine by taking their medication with appropriate dosage at suitable timing. Should you experience any discomfort, always refer to your health consultant for further assistance. To all the Alzheimer's patients, stay confident and cheerful. There's nothing else that can defeat you unless you defeat yourself. Try to simplify your daily tasks and perform them according to your own pace calmly. Remember, you are way better than you were yesterday. Last but not least, we would like to take this opportunity to encourage the public to show your support towards the Alzheimer's patient. They deserve a normal life just like you. Your proactive approaches towards Alzheimer's patients and their families will be highly appreciated. Although currently there is no cure available for Alzheimer's disease, however, the sooner we start to acknowledge and manage the disease, we can slow down the disease progression and improve the patient's life quality.